I am Dr. Niti Mathur on the Voice of Healthcare platform. I am currently serving as a Vice President and Medical Director in Rialtic, a startup payment accuracy firm based out of the US. Rialtic allows both its payers and providers to execute their own unique payment accuracy strategy through their own marketplace platform. I have behind me 20 years of experience in both the provider as well as the payer domains. I am happy to take this opportunity to welcome you to this discussion, a part of the Indo-Taiwan Summit. The topic of the hour is exploring synergies in health tech, digital technology, and healthcare IT. We will also try to understand the evolving compliance and regulatory terrain. Before I start, let me do a quick round of introductions of a very distinguished panel. We have with us today Saurabh Kochhar. Saurabh is a serial entrepreneur and currently the co-founder and CEO of Meddo, India's first end-to-end aggregated private clinic chain. Meddo is transforming how primary and secondary care are being delivered in India. Hello, Saurabh. We have also with us today Dr. Sanjay Sood. Dr. Sood is the Program Director for eSanjeevani, which is the Government of India's national telemedicine service initiative, slated widely to become the world's largest telemedicine platform. A change leader, Dr. Sanjay is in the forefront of leading India's leap into a connected future. Welcome, sir. Next, on the panel, we have Mr. Piyush Bhan, Vice President and General Manager, Salucro Healthcare Solutions. Equipped with business, technical, product, software, and legal experience, Piyush has helped multiple companies set up and grow scale in India. He wants to ease the making of payments for the patients and make reconciliation easier for the providers. Piyush has already helped Salucro to build up more than 800 customers spread over the US, UK, India, and Europe. We also have with us the CEO of Epillo Health System, Mr. Aasif Shah. Aasif dons multiple hats, and he is a digital healthcare evangelist, a TEDx speaker, has worked to drive digital healthcare transformation, and has done some phenomenal work on EHR and on patent pending technologies like drug-food interaction. I'm honored to be having these panelists for the discussion today and moving on with the agenda for the hour. So, Saurabh, allow me to open the discussion with you. So what are the prominent and emerging digital technologies in healthcare and how are they impacting care coordination in India?
Well, I think technology in healthcare is all pervasive. The problem in healthcare has never been availability of any of these technologies, right? So the problem has always been adoption, and I would say, it can be from the first starting point of technology intervention, whether it's through teleconsultations, whether it's through whether it's telemedicine, e-pharmacies, so on and so forth, and then even going into, I would say deep tech like gene therapy, like, prediction algorithms and everything. So I think there is a lot of brilliant work being done across these segments, some of those more massy in nature, some of these far more, I would say niche and, I would say very, very deep in terms of their, overall tech experience and depth. But the problem always has been how open and okay are clinicians to adopt these into their regular practice behaviors. And while there's always with technology more and more distance that we can travel, more and more advanced that we can make it, I think an equal amount of time and effort needs to go into two dimensions, right? One is making them easier to use, even if it's the same solutions, right? Bring an Apple approach pretty much to some of these existing pathways that we already have. And the second one, apart from just making them easier to use, has to go into driving adoption, whether it's through I would say incentivization, whether it's through policy interventions or whatever it is. So I think coming back to your questions, while there is no way to limit or to even categorize broadly, the kind of interventions that we have, technology, but let me still take a stab at it, right? So one is this entire coordinating the care segment where your telemedicine comes into picture, where your video calling and all those things, whether it's clinical management solutions, whether there are practice management solutions. So all of them are kind of clubbed into one big, bucket in itself that I can call the care coordination bit. The second big bucket for me is around helping the clinicians with the right decisions, where the CDSs of the world come into the clinical decision support systems come in, whether it's in terms of triaging, whether it's in terms of teleradiology, where we are already predicting in terms of what could be wrong in all of those things. And then the third is where there is technology that is, I would again say, much deeper integrated and helping with the interventions themselves, whether it's robotic surgeries and so on and so forth, right? And I'm sure the panelists will potentially be able to help me add more categories to it. But broadly, I see these three big buckets in which we can club the technology. And then there's, of course, horizontals around it. Some of these are AI-based and ML-based technologies. Some of these are pure rule engines. Some of these are just the simple interfaces and softwares, right? So there's a matrix there that we can think about. But like I said, we have enough expertise and enough efforts going into each one of these verticals. Where I think I would want to see more is how do we drive adoption of most of these solutions, and I would say bring to surface and precipitate the actual impact some of these technologies can have on our healthcare overall.
I completely agree with you there, Saurabh. I think one of the issues that we are having is, fundamentally not how to make these technologies, but more about how to get them adopted by specifically, I think, the physician community, and a lot of the focus needs to be around how we would be able to transform this patient-centric model into the physician-centric model into a patient-centric model. So I think and that to a point maybe is um, probably something to do with a loss of a sense of authority or a power. Once technologies are there, there's always this underlying insecurity that individuals have, and we'll come to that later along our discussion. But yes, thank you for categorizing our technologies. So moving on, I know Piyush, and this question goes to you. We are aware that the National Digital Health Mission was launched by our Honorable Prime Minister last year in August. And so what do you think is its role and importance of this mission in India?
Thank you for bringing that question over to me, Niti. It's wonderful what the government is picking up in terms of digitizing the entire ecosystem. They started the step one that they started with was the financial institutions with respect to the policies that they brought in. The step two that they've taken in a very good direction is related to healthcare system. Now, National Digital Health Mission has released multiple white papers and has called for multiple requests from different technology companies, different experts, subject matter experts in this domain, requesting for what are the changes that can be brought in. And bringing all these details together, there are different camps who are working very closely with the National Digital Health Mission to bring this into reality. One such example that one of the groups that I'm associated with, that group is called Swasth Group. And with that group, we're very closely monitoring what are the different kind of functionalities and features that can be brought in. So one of the simplest thing to start with is the communication of health related information, interchange of health related information between healthcare providers. Now, this has been a very big challenge across India, across healthcare systems, wherein one hospital doesn't want to share the details of the patient, of the healthcare delivery that they've given with the other hospital. Now,
Right.
what NDHM has proposed, they proposed layers wherein you can remove information that is private to that specific hospital, but release the information and share that information with another healthcare provider with respect to treatment of that patient, so that there is a history of the line of treatment that the patient has received, and the next healthcare provider can actually treat the patient in the right direction. So that's a very basic step that has already been taken up, and there are objects that are being created around it. There are base layers that are being created around it. The second one that is ongoing right now is with respect to insurance. Now, the government of India launched the insurance scheme for the entire nation. Everybody gets covered under the insurance scheme, the healthcare insurance scheme. Now, how do you manage it? How do you take care of it? So, another layer that is being added right now is with respect to sharing the codes, creating codes related to the services that have been delivered at the hospital. And this information can be exchanged between an healthcare insurance provider and the healthcare service provider digitally. You do not have to anymore carry those bulk papers. You do not have to exchange emails, and you do not have to maintain those paper records every time for getting the money dispersed. And the same thing is going to happen with respect to the central government as well. And the reason for starting this up is to remove all the leakages that are happening in the system. So there are multiple things that are going on with respect to digitizing the healthcare ecosystem in India. What is happening right now is government is going in the direction wherein they are creating a UPI kind of layer for the healthcare system. What UPI really did for the banking infrastructure is basically open it up for multiple startups, multiple private companies to come and bring in their technologies and enhance and build on top of those layers. Same thing what the NDHM is doing. They're providing the base layer, they're going to be providing the base backbone. And on top of that backbone, you can create your own services, you can create your own layers, you can create your own applications, you can create your own offerings. Now, this is an opportunity that is available to multiple startups who want to foray into health tech, who want to foray into healthcare domain, that they can build over these services. There are multiple white papers that NDHM has released. There are multiple details that are available, and there are documentations that the NDHM has released over a period of time. I think there was one that was released in the month of July, which is available in public domain. Anybody can go in and see what the track and update that is going on over there. And it is really fascinating, and I'm very happy to be part of that group wherein you can see it real time and take that information back to different startups and help them in understanding what's really going on. And this is something that is new, that is something that is different, and this is an approach which is being, it is more like a top down approach wherein the government is pushing it down to everybody, versus we as startups, we as technology companies, we as private companies pushing it over to the government and saying, you know what, you need to give us this. So this is a different approach that is happening, and it has happened over the last couple of years, where we're seeing this change, and the support that is being provided in terms of monetary support, in terms of technology support, in terms of infrastructure support from the government, is amazing. And with the NDHM coming with all these details, coming up with these documents, coming with the base layers, it is going to come up, help multiple startups come into the zone wherein they can create services, they can create solutions which the bigger companies and which the bigger universe can start using. So this is a very, very, very good step in the direction. One such example that I can talk about these services and the solutions created by the government, like the CoWIN app, that is being now utilized at an international level, and the services are going to be provided for that. So as tech startups, as technology companies, as tech mindsets, we are being provided the opportunity, we are being provided the infrastructure. Now it's all on us. How well do we utilize it? How well do we create services on top of it? How well can we get connected and provide these offerings, not just to providers, but to the end users as well? Now, how can we make the life of a patient, of somebody who's unwell, easy? At the same time, how can the operational overhead of a hospital be reduced? So this is the concept that NDHM is going with, uh, by creating a universal healthcare system within India. And this is a similar system that is available in multiple developed countries, and we're already hitting in the right zone. We're moving in the right direction. We've learned from the mistakes that other countries made while bringing up such policies, and the
Correct.
government is ensuring that we don't make those mistakes again. So that is something that I can say from my side. And in the last 1.5 years, if you go by numbers, there's nothing less than 500 startups who've come in the healthcare domain, who are picking up and starting up newer services, newer layers. Some of them are in the COVID, some of them are related to medicine delivery, some of them are related to home care. So multiple startups have come up, and with this policies of NDHM coming in, with the base layer of NDHM coming in, it is going to give a lot of boost to everybody to think in that direction. So that's my take on it. I'm closely
Thank you for
involved and closely
highlighting.
looking at it, so I can definitely talk about it.
Thank you for highlighting that fact, and it is probably an indicator of how interested our government is in pushing for better quality of care, and for overall better services, healthcare services in India. So this is definitely a first one, because otherwise the private sector would generally be struggling on its own and possibly coming up with its own recommendations, which at times would or would not be heard. So that's great, and it's also good that we are looking at the other countries, because interoperability and electronic claims, the processing of electronic claims, that is, are kind of known issues, and US has definitely been through a lot, and despite and has not been able to overcome those challenges. So we can learn from them, and avoid at least the glitches that we see upfront. So but yes, on part of the government, I guess this is a wonderful step. Sanjay, in continuation, do you think that NDHM has been able to create a significant change in the development space of health tech startups as of now? It's still new, it's novel, and years gone by. But what, in your assessment, has been the contribution of NDHM? Sanjay, you're on mute. Perhaps you need to unmute yourself.
Oops.
Yeah, that's fine.
Thank you, Niti. Very much as Piyush mentioned, we all know NDHM and its unified health interface will certainly do the same wonders whatever UPI did in the domain of payments, etc. And we are certain that it is all going to radically transform healthcare domain in the country. And NDHM has been designed on the principles of ensuring greater inclusivity, efficiency, transparency, besides interoperability in the entire sector. We do understand the availability of healthcare infrastructure and the service delivery needs. They need to be really strengthened in the country. However, the technological empowerment and digitization can most certainly enable more effective and efficient utilization of the existing facilities, and also enable these healthcare IT applications to talk to each other, and then ensure that the data is available for the end user or for the patients to use at their will. So NDHM will certainly boost the confidence of the health tech entrepreneurs as well, and especially the new entrants in the domain who are using technological innovations like AI or machine learning, etc. And these health tech startups can now easily start to think about easily working with providers and insurance to facilitate continuity of care, and not only continuity of care but also assist various providers like the insurance companies and various other similar service providers. The government can also now collaborate much easily with newcomers in the digital space who share common vision and mission to address any challenges and build health tech infra to help bring about the connected healthcare dream to reality. So to say we are managing, national telemedicine service, and on daily basis we are now receiving requests from various startups discussing modalities to synergistically design modules to empower patients and practitioners. I'm sure with this kind of trend, increasing, and as Piyush highlighted, the way COVID is being utilized by other countries as well, and even it is open for use uh, by 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 private players in various forms. The same way, the health tech applications or healthcare IT applications will certainly find more users, more applications, more, and hence the entire health ecosystem or digital health ecosystem in the country would grow. And it is for sure that next 2 to 3 years will certainly be really the most eventful era in the entire landscape of healthcare, or rather digital healthcare in the country. And as far as you know the roadblocks that we see as of now for the entrants to get into this domain of digital health, or to get on board the DHM's bandwagon, it could be that the information about, or the awareness about healthcare IT standards is raised, and that certainly would aid or would facilitate or encourage more and more startups to get on board this digital health bandwagon in the country, and eventually benefit everybody or all the stakeholders in the entire domain.
Correct, absolutely. And so it's also actually serving as a collaboration platform between the government and the private players, as well as the regulatory bodies, the various stakeholders, basically inclusive of the regulatory bodies. So to bring everybody in sync, hopefully it will have very powerful impact um, on the design and the delivery of healthcare in India. Asif, apart from telemedicine practice guidelines and the NDHM launch, what other regulatory support is required by the healthcare players to further grow in India?
Uh, Thank you, Dr. Niti, for the question. As Mr. Piyush, Mr. Sood, and Saurabh spoke about it earlier, I think the only major point I would like to add to the NDHM debate would be that the use of e-health tools, medical and wellness applications inside the system in symbiosis with electronic health records can increase the long-term value it offers to public and private players. Now, the public and private players need to be empowered and enabled to join together in this platform for a common objective of digital first approach. And as far as the policy speaks, it is already being done. All the private and public players and healthcare applications are being brought up on this universal platform in a UPI-like structure, creating universal health IDs to enable, faster interoperability of these services and deliver the data where it is required at the point of care. And that's pretty much it that I'd like to add to this debate.
Right, right. Um, Okay, moving on. And back to you, Saurabh. So you talked about bucketing the technologies, you created three buckets, but where do you think the highest impact is going to be of these technologies, on the Indian population? So, which is the area that you think is going to really dominate in terms of? I know Meddo is working in outpatient
Outpatient
care.
care, and for a reason, right? In fact, I would say for the same reason, because uh, see, I think the broad disease burden profile in the country is changing drastically, right? So we are at a point where over the next 5, 7 years, maximum 10 years, more than half the population will be suffering from one or more of the chronic conditions, right? So at least in the top cities, more than 50% of the population will be engulfed with one or more of these top 10 chronic conditions that we are staring into, which would mean that, like I said, the disease profile and the burden of the healthcare system overall is going to change drastically, and it's going to more and more move to active management of these conditions rather than, well, unfortunately, we do find ourselves in middle of a pandemic. So a lot of what I'm saying is kind of counterintuitive to think about at this point. But once this goes into the endemic stage and the life comes around to being a bit more normal, outside of such episodes, and God forbid another one happens ever in our lifetimes, uh, the bulk of the healthcare expenditure will need to go into management of these active chronic conditions, and thereby the role of outpatient care and maintaining, I would say, long-term, longitudinal patient records, etc., has been one of the important angles to it, which I think NDHM is also very, aptly trying to solve for, is going to remain the key, I would say, area of interest. And like you mentioned, that's one of the reasons why we started Meddo, and we're working in the outpatient care space, because everything else is less than 1%, right? Your clinic visits, your regular physician interactions form 99% of all healthcare interactions in India and even otherwise globally, right? So think about it. Most hospitals would run with about 3% outpatient to inpatient conversion ratio, and hospitals themselves will have less than 10% of the total footfall. So just doing that mathematics will lead you to, yeah.
Which is true. At the same time, it's the inpatient cost that really dominates the healthcare cost. It is
Of course,
that
this is why you,
that small
yeah,
percentage of the people who are
yeah,
responsible for the basic healthcare costs.
and
So that,
wrongly so. And wrongly so. Why? Because
right.
I think just by we've always since our childhoods heard this saying called "a stitch in time saves nine." Well, healthcare is the perfect example of that. The reason why we are pushing most people into the hospitals today is because of wrong patient behaviors and the wrong incentive structures around it. Today, you have about 50% insurance coverage in the country. That in outpatient care is less than 1%. Everybody, whether it's a doctor, whether it's an institution, or even the patient, everybody is incentivized to actually delay the care till the point you get onto the bed. Take another case example of cancer. 70% of the patients detected with cancer in our country are detected in the terminal stage, which is stage 4, which is more than double of the global average. Why? So while we can keep having the mindset, I'm sorry, I'm kind of just pointing because it's something that is very close to my heart, and it appalls me every time I talk about it, right? That just because of this mindset that that 1% has about 40% of the base in terms of expenditure is the precise kind of mindset that's driving us more into the hospitals. My belief is we can cut down the hospitalizations to half if we are actually putting together a much better organized outpatient care. So every time you ask me, and I don't know how all the other people around the panel feel about it, but it's not going to change my belief that the single most important area for us to focus on when it comes to where healthcare investment, not necessarily in terms of dollars or rupees, but also in terms of consideration, technology, and efforts, most importantly, has to go has to be in the outpatient care, has to be into changing patient mindsets and behaviors to be able to open themselves to the healthcare paradigm ahead of time rather than when it's too late. Yeah, we lose 2 million people. I'm sorry, I'm going to keep throwing numbers at you now. So we lose 2 million people every year purely because they could not get the right care at the right time. 2 million people, and it's not people who are in like remote areas not having access to hospitals. No, that's not true. It's not the critical casualties that we happen because of accidents and everything, and thereby we are paucity of time. They're part of it, yes, but are they the dominant part of it? No. Bulk of these are actually where we just did not take the healthcare interventions with the right in the right time with the right quality,
Which
and
is
that's
where,
what we need.
which is where I suppose technology should help, right? Because then
Yes.
that will increase the accessibility that people have and reduce the cost. Because one of the things that we find with chronic diseases, or for that matter, even for infectious diseases, is that the patient has to keep on coming back and forth,
Yeah.
to the hospital, and maybe he's coming from a remote area, or
Yeah.
somewhere where they don't have facilities,
Yeah.
and then that becomes a bit of a drag on him in terms of time, effort, money, and all of it, which is where
Correct.
technology really needs to, we
Yeah.
expect that it should push. But
Correct.
yeah, I appreciate that point of view. um, and given that India is facing a double whammy, because we have this chronic diseases on the up, and also our hygiene standards have actually not really improved. So our infectious diseases, are also going to be
It's not like
on
they're
the way.
decreasing,
Yeah,
they're constant and slowly increasing, but the chronic conditions are kind of, you're right, it's a double whammy there, right? So we have to kind of take care of the population from both perspectives.
entirely. Yeah. And so, Piyush, which technologies are you tracking that you feel will help improve the quality of care delivered?
Yeah, so with respect to technologies that I'm
Well, he's the
tracking,
government's man.
I'll say that again.
I said he's the government's man.
No, not exclusively government's man, but then when you see something good happening, you should always talk about it, whether it's government, non-government, private or not. So the technologies that I'm tracking, I'm going to bucket them into three segments. One is the outpatient care delivery. That's number one. Number two is going to be AI, artificial intelligence. And number three is the insurance. So these are the three segments that I'm really closely watching. Now, in terms of the outpatient technologies, what I'm referring to is not just booking an appointment or getting care at home, but how can somebody in the remotest of the possible area in India get access to healthcare? So that's the outpatient technology I'm referring to. Now there are a few companies who are making some, who created some interest in me, and I'm like closely working with them as well. Wherein you have instruments, you have devices, which can be taken to remotest of the places. You really don't require these devices to have internet in them. All you need is a mobile phone, a device, mobile phone device, which has basic internet connectivity if available. If not, you can go to the nearest area to upload the data. So what these devices really do is they take the measurements, they take the details, they take the vitals of an individual, feed in the information, and pass it to the central segment. Now, the central segment could be a municipal hospital in the nearest city. It could be a privately run and a public-private partnership run campaign, which can do it. And that is something that I'm closely tracking of how we can scale these technologies, how we can make them successful, because that is going to improve the care delivery of outpatients. Now, it's not necessary that you'll have a government hospital everywhere, every section, but there are, SWAST agents, there are government agents, or there are private players, if you have that partnership, who can travel to these remote places, meet the people, run campaigns and provide care delivery. And there are pharmacies, government-run pharmacies, which can supply you with the medicine. So That's one technology which I'm really closely tracking. You have a question? Go for it.
Yes, while you were talking. And so that's such an interesting thought, because are we saying here that healthcare technology is actually following the distribution uh, of mobile technology? So where, if the mobile is there, then we'll be able to deliver healthcare. So that's a fantastic kind of a thought, if it may be, and probably instrumental to the success. um, the second thing that you talked about was remote monitoring. So uploading the data and then it being centrally monitored from a place, and which is true. But and also, I guess that one of the things that will ensure success would be running a backend analytics over all the data that is uploaded then, which would, at a population level, which would help us, kind of target. Uh,
So that is where really AI comes in. So that's the second phase of it. Now you have the data, you have the rule engines. How will the data be fed in? How can you create the rule engines to monitor this data, monitor this information, and create deliveries, care deliveries. Now, what Saurabh rightly mentioned, that we are not a proactive agent, we are reactive agents. So when we really really become critical, that is when we get into the hospitals, and that is the reason. And the incentives are totally different in that domain. So when you combine outpatient, what the deliveries and the technologies I'm looking at, then you combine the artificial intelligence and the AI running for these data and creating care deliveries for it. The third segment is the insurance piece. Now, when I talk about the insurance piece, it is more relevant to not just data exchange between hospital and an insurance provider, but create insurance from the perspective wherein we can provide insurances with respect to an incentivized outpatient deliveries. Now, this is a topic that I've picked up with different insurance companies over the last 2 to 3 years.
mhm.
There are multiple insurtech companies who are coming up, but there's actually a reluctance right now in India with respect to the different insurance companies of who's going to underwrite those costs, what are the our margins that we're going to looking at. Because once you start going into that direction, what really happens is everybody would be just running in and calling in for their insurance company, and until and unless a model is decided and a model is created, it will not become a successful model from the insurance company's perspective, nor a successful model for us as an individual. So the incentivization doesn't have to be just, okay, I have an OP insurance, I can go and I don't have to pay anything. But it has to be in a totally different manner where things are connected, wherein I've got some tests done, and now when I've got some tests done, it really requires me for the next step to get talk to a doctor or talk to somebody. That's when these concepts can come in. So I haven't heard or looked at any insurance related companies who are coming and solving this specific problem. But once that insurance layer is laid, once that backbone is created, I'm hoping over the next 2 to 3 years we'll see such companies also coming in. And
Oh
when you
yes.
combine three of them together, that's like the best solution that you can get with respect to the healthcare.
Yeah, it will definitely drive insurance penetration in India. This sort of a scheme. Also, one of the things, it's probably not working for the insurers, and you're right. But then one of the things that the US did to kind of counter this was, they set up rules engine for claims as well, and created technical policies around, what should be paid and what should not be paid, which kind of decrease the payout ratio. So that was just one of the solutions. And uh,
Right, and that actually exists for IP inpatients. That actually exists right now for inpatients. The packages are created, the mapping
yeah,
of what should be paid out, what should not be paid out. Plus, government had also come out with the policies with respect to home care for COVID patients as well, wherein they outlined that these you can not pay and the others you can pay. So these are certain things. If the private players also come in and they are interested in doing this, the government
So I think
really want
Piyush,
to shift
you are there's some connectivity issue, and in the interest of time, I'll move on. So, as if the next question goes to you, so much of talk about technology. Do you think it is technology versus human, or is it technology for human? Oh, you're on mute.
Thank you, Dr. Niti, for the question. I think it's a very interesting question and a long time debate. Technology is always created by humans and in turn redefining what we call and will do. So every single technological change is now impacting humanity in a much more deeper way than we ever could have imagined because technology will soon impact our own biology, primarily by the rise of genome editing and artificial intelligence. Now, technology is no longer just a tool to achieve something. We are actually becoming tools ourselves. Some of my futuristic transhumanism, something I personally think we should examine with great caution. Yet, exponential technological development in sectors such as computing, genome editing, healthcare, nanoscience, material sciences, and energy is emerging, and it has reached to a point where the computing power of these machines is becoming equivalent to our own minds. I'm very much hoping that humanity can indeed be steered just to sit on these machines and drive the direction. Right now, we pretty much have good cards for that. What we
So,
need is a human stewardship that masters this transition into this new machine era. Uh, I think we should spend more on training humans to embrace this technology. Otherwise, what will happen is machines will become smarter and we can become dumber with time.
yes,
That's my
absolutely.
response.
So, are you envisioning a future without physicians?
Yes, I think deep technology is trying to enable that. The role of AI is that you need the doctor only when you need it. Otherwise, personalized medicine, and precision medicine, and the use of AI in that domain has a lot to do with not going to see a doctor.
Even while we are being very objective, and I am fully supportive of technologies, generally speaking. Now, how do we take care of, the touch, a doctor's touch? I mean, that is something that technology it's so dry. Many
I,
times, the
I,
patients what they need is not just an outcome. What they also need is empathy, which is a
yeah,
skill that technology. I think that technology will not
I
be able
think
to.
technology is there to amplify the care, not to replace a physician's touch. And physician's touch will very much be there. And the need of doctors is already there in countries like India, and it will never go away. Technology is just there to amplify the care coordination and personalize the medicine and the experience and the overall care experience. Yeah.
Thank you.
I actually fully second that because I do not believe, that it can ever be, only teleconsultation or only telemedicine. It is a fantastic, and fully, double down on what Asif is saying there, right? That it has to be available because there's so many use cases that technology can simplify and so beautifully solve. But can it completely replace? The answer is no, right? So to get to a good, effective care, a doctor needs a lot many more inputs than just what the patient is saying, right? But things like follow-ups, things like mental health, things like sexual health, where there is already, a taboo or where there is already lack of access, by providing that direct line, you can solve so many more problems. But I think it is not the best thing to take one use case and apply it, across the board, right? So I think that's what we need to be cognizant of. And while the technology will still make leaps and bounds, today we do not have an answer for the touch and feel that you asked, but we might have it tomorrow. But
Yeah.
even then, does it completely replace? I would reserve my doubts, at least at this point I'm open to changing my mindset around that.
Oh, small mercies. I spent half my life just reading. Okay, so Sanjay, coming to you, what role do you think will telemedicine play in the future? And again, the question is, do you think it will replace physician evaluation?
Well, till the beginning of the pandemic, that is early 2020, the experts, researchers, practitioners, they've all been seeing healthcare stream as a laggard in adopting IT applications. However, the scene changed drastically, as we know. The pandemic brought about a paradigm shift in the entire way the practice is conducted, the medical practice is carried out. And as per a specific study that has been published in one of the journals, it states that around 70% of the encounters between the patient and the doctor can be managed virtually or without being face to face or without being even touching. So with that in mind, and the fact that the way telemedicine has been used during pandemic, I can say that now, as both the users and the practitioners, they've got familiarized with this modality of digital health. So telemedicine is, of course, here to stay forever. And as of now, telemedicine is enabling teleconsultations, which is one of the applications of telemedicine that we are into. And I think majority or very close to almost all the episodes of telemedicine, they are majorly teleconsultation based interactions. And with healthcare technology applications centered around AI or IoT growing at a phenomenal pace, we are now getting into the domain where we have wearable devices, we have compact point of care testing devices, we have rapid diagnostic test smart kits in the market. These are getting cost effective, day by day. They are getting portable as well, and hence we all are set to see these maturing into something which will lead to the next higher application of telemedicine in the domain, and that is telediagnosis. Even we are trying to conceptualize a model or conceptualize a prototype or a platform for running clinical trials to enable telediagnosis, or rather diagnosing ailments from a distance from various specialties. We are picking the easier ones first, wherein the specialists or the doctors need very little information, but really the information that helps them to decide or to diagnose a disease. So the future here now is that we've tested, we've experienced teleconsultations. We are now in for even more fertile application of telemedicine, that is telediagnosis. But for sure, as we've been discussing, say close to around 30% of those cannot really substitute or overcome the need of physician touching the patient or physically examining the patient. So I think in times to come, telemedicine will be an integral part of the medical practice, much more than what it is now. It will help to reduce the crowding at clinics or hospitals, and at the same time, the doctors will get more time to in person see the patients in person who actually need significant time of the doctors. So that is how we feel that the field is going to evolve in times to come.
That's a very interesting point, because what you're saying is that it will get integrated into the practice of medicine. What is surprising is that despite all this talk that we are having around technology, nobody seems to be talking about upgrading the doctors themselves. I've been a part of the system, and the first time that they are getting subject to exposed to a telemedicine consult is once they are in practice, which is half their life gone by. So but there seems to be no attempt to take these technologies at to the audience. By audience, I mean the physicians, at the time when they are learning, so that it becomes a part. So the integration becomes kind of easier. But definitely a point that needs to be looked in, and possibly an opportunity area. So thank you, Sanjay. Saurabh, what is the role of investors in the success story of health startups? You being one. Are you on mute? I can't hear you.
Can you hear me now?
Yes.
Yeah. So I think the right support system can make or break any organization. I don't think healthcare or health tech is any exception to that rule either, right? So a lot of these things sometimes do need upfront belief in the vision, in the way it needs to develop over time. So yeah, I think of getting the right partners also at the right time. If the money flows in too early, it's always detrimental. If the money doesn't flow at the right time or comes in too late, it's anyways not as useful, right? So and healthcare, unfortunately, and I will talk from a startup perspective, till lately hasn't seen many smash hit stories, and that's one of the limiting factors which I would say understandably so is keeping a lot of investors largely interested but largely at bay as well, right? So everybody wants to do healthcare, nobody's really doing healthcare, right? So yeah, so and that becomes a challenge because then there has to be at least a few people guiding the path in terms of what it can be. So, but the good thing is that's changing. We are seeing some big ticket deals. We are seeing a decent amount of consolidation. All of these things kind of help towards getting more investor confidence in. Exits has been one of the problems in India for the longest time. But with IPOs now happening, that one exit path is clearly opening up through consolidation, M&A activities that has been happening at a breakneck pace over the last 2 years, especially. Has been a great positive contributing factor towards that. What remains to be seen is a lot of the deals that are happening today are not the best priced deals, right, for the seller in a way, right? So how does that continue once the dust settles a year from now? Is going to be an important parameter to watch. But overall, I think the right amount of capital coming into the right kind of models at the right time, and there is too many rights in this statement, right? So, but
Right.
but yeah, so but that's an investor's job pretty much, right? So that's how they earn their bread, to figure out how all of these ducks line up, and I think we're at the right time to kind of make. Still remains to be seen. I don't have evidence yet. I have a lot of talk. Let's hope the next couple of years see that evidence of.
Crossed. Absolutely. And I said, keeping our fingers crossed, and possibly, the government could also have a huge contributory role as an investor in this. Not as a
Yes,
private.
from a deregulation perspective, or I wouldn't even call it deregulation. I think it's just about clarifying. A lot of the regulations that exist in and around healthcare are not very crystal clear, and a bunch of business models as well as practices are happening in the gray zone, which isn't good for any economy, right? So especially in young organization, it kind of hits a bit more. That said, I think we have done a lot of good work over the last 2 years in terms of bringing out telemedicine regulations, I mean, we do so much talk around it. It's been something which has been existing for a couple of decades now, but we never had regulations around it, right? So just bringing that from the gray into the white has been a huge step. I think there's many more such segments that need that kind of intervention, including e-pharmacies, right? So there's this significant leaps for us to make as providers, as regulators, as investors to kind of make this happen. But yeah, I think each player plays a very important role if you have to make this into a smash hit success.
Absolutely. Piyush, continuing in the same tone, and in the interest of time, we would need a short answer. What is the role of industry partners?
So the role of industry partners, I'll take it from two perspectives. One is your ideation stage to give the direction, and the second is growing the product. Ideation stage is generally recommended that whichever is the segment that you're targeting in, bring up the experts from those segments. If it's specifically for hospital, like specifically hospital, bring in some industry experts from the hospitals, get them on board, talk to them, share your idea with them, get their experience, and think about whether this idea is going to be successful or not. The second is once the ideation stage is completed, and now you're planning to put together the product and the solution for it, that's when you need to work with technology experts. Now, when you work with those technology experts, they can actually give you the direction of how you can keep your technology costs lean while still delivering a good product. When you combine these two together, what will happen is you'll have iterations of your product where the industry expert for that segment is going to view, use, and give you feedback. And in this feedback loop, you'll go in and you'll work with the technology expert of how I can pump it in. So this is how an industry expert can help any startup, not specific to healthcare, but if you talk about hospitals and the healthcare segment, these would be the two ways that any industry expert can help a startup: ideation and technology.
Technology, yes. So as we draw to a close, Aasif, one last question, quick shoot. Would you
Sure.
like to throw some light on the opportunities and challenges that the pandemic has brought?
Absolutely. I think everybody here agrees that healthcare sector has been at the center of the COVID-19 crisis. I think one of the most visible challenges due to this COVID-19 pandemic has been how people access the healthcare system. I think the strategies that shift care away from the hospitals, enabled with technology, enabled with home care, enabled with mobile MApps and wellness applications have gained momentum. I think majorly because the precautionary aspects of the people have arisen because of the social distancing guidelines and the pandemic. As a result, digital tools like video conferencing, translating into telehealth, remote monitoring, data analysis are playing an increased role. Emerging IoT devices, e-health records. But I think despite the success, the gap remains in what patients want and what the providers are currently offering. I think the next wave of virtual care solutions and services, at least in India, is likely to integrate personal health records in order to create a more holistic picture of a patient in front of the care provider. And I think that's what NDHM has been up to, and that would be my answer.
Yes, absolutely. And I agree that this is one of the things, it depends upon what the patient wants. Now, interestingly, when the pandemic was at its height during the third wave, the footfalls in the hospital actually fell down quite a bit. But now that it's in a state of remission, what we are finding is that people are back to the hospitals when they have the availability of going through the telemedicine consults. So
I
it's
think
going
going
to take some
forward,
time for the
yeah,
patients to kind of
yeah,
adopt it. But yes,
exactly.
but thank God for technology that we were able to kind of deal with the crisis. There were lots of patients around who we were able to serve thanks to all these technological interventions, and thanks to the efforts of people like yourselves. We can confidently hope that the technology will be an enabler, facilitator to deliver quality-based, cheaper care. On that positive note, I would like to conclude this session by thanking all of you as my panelists and our audience for listening in.